always knew this day would come. We've been planning and preparing for this time where we begin to shift our approach and our thinking a little bit in terms of making it more convenient, a little bit more accessible, and begin to do some more creative things. Yesterday, we announced that all 23 of our county-operated vaccination sites now have a drop-in option, meaning you do not have to have an appointment. You can just drop in and get an appointment. The super stations, those locations remain appointment only for now. But the 23 sites, again, you can still make an appointment. Appointments are still available, but you also can drop in. And so our message to San Diegans today is there are now vaccines available, both via the appointment system and via the drop-in alternative at 23 different locations throughout San Diego County. And so we encourage a lot of folks that may have gotten frustrated with an inability to get a spot to go to our website, vaccinationssuperstationsd.com. Look at the array, the times, the locations, and please take advantage of those. We also are going to work to extend the hours. We know a lot of folks, even though everyone in California, employers have to provide paid time off for employees to get vaccinated. We know it can be hard during the day between work, school, kids, family, other obligations. And so within a week, several of our sites will expand the hours of operation until 8 p.m. And we will announce those as those expanded hours come online in an attempt to try and make it easier. And we have plans in the coming weeks to extend some of those times beyond 8 p.m. and are exploring the feasibility of a 24-hour location. A lot of shift workers and different type of folks, again, just working to try and provide more options and more convenient ways to make it a little bit easier for folks to get. We're also working to create more mobile sites, and we are working with religious groups, with large employers. We're looking at heavily trafficked areas where we can go up and set up mobile locations where people can drop into that location. Could be 1 or maybe 2-day events that we do, and move those around the county. Again, we'll share that information and share a schedule behind that. In addition to that, we're going to reassess our public education campaign. As you know, we showed many of the ads we've been doing, both digital ads, radio, television. We have a robust door hanger system. We're working with cities to provide door hangers, information on how to get the vaccine. And we've seen great success from that in terms of impressions and communities reached. But we will look at how we might want to revamp that as we head in to the next phase behind what we are doing. And we also will be going into the field. We did a survey at the end of December assessing public opinion around vaccines. We're going to go back out in the coming weeks and redo that, get a little refreshed view of what people are thinking about the vaccines, what concerns may be, and we expect to have the results of that by June 1st. We will share that. We will also use that information to guide a lot of our outreach efforts. In addition to that, we're ramping up all of our engagement with various sectors. We've had a considerable amount of energy and effort around even very small conversations addressing folks' concerns, and working through that, having medical professionals available. Those efforts will continue. And in particular, we're launching a very focused effort and program targeting our youth. Those between 16 and 34 may not be hesitant to get a vaccine, but may not see it as a convenient option. And so we're engaging with a lot of community partners and a lot of thought around how we can increase participation there. So we always knew at some point we would, the folks very motivated would get it. We think there's still plenty of San Diegans who are open and willing to get a vaccine. We just have to work a little bit harder to make it a little bit easier to access. And all of these efforts, again, will unfold in the coming weeks and coming months as we proceed through this. I will share with you, last week we had a big jump in the number of vaccines we received, week over week, significant increase. This week we got about what we got last week, just a little bit less, but holding very steady. We suspect next week may be an increase, but we won't know until next week. And I will share with you the specific numbers on that whenever we get to the slides. As has been widely reported, the CDC this week revised the mask requirements for folks who are fully vaccinated, creating less restrictions for those individuals when they're outdoors and not amongst large groups. California Department of Public Health agreed, and so does the county. Dr. Wooten, as public health officer, concurred with those guidance. And so under the new guidance, fully vaccinated people do not need to use a mask when they are outdoors with members of your household. when you're at small event outdoors with fully vaccinated family and friends, or with unvaccinated people, or when you're dining indoors with multiple households. But we do still encourage folks who are attending crowded outdoor events or indoor events with folks who are not in their household to continue to utilize a face covering. That's just designed to protect. We're only just over half of San Diego that's been vaccinated. We're on the seam. You know, we're moving forward, we're advancing forward, but we want to continue to be cautious and continue to be safe. Final point on vaccines before we get into our charts. I just want to note we've been working with the VA to get their San Diego specific totals into our totals. They don't, federal entities, the VA and DoD don't participate in the normal reporting systems aligned with the state like all of the other entities. And we're happy to report the VA has provided the data on vaccines they have administered, just under 69,000 to San Diego County residents only, and we are adding that into our dashboard totals, which you will see increases our percent by about 2%. We've also had extensive conversations with the Department of Defense on getting their numbers, and very grateful to Congressman Scott Peters and his team for their work and help, and we expect in the coming weeks we'll be able to add in their numbers as well. Finally, when it comes to our case rate, we're holding steady. You'll see here in a minute, right there, around just north of the 6.0 number. There are some other counties, LA and other counties, that are descending a little bit lower case count, and we don't know exactly all the reasons why. There's fluctuations or variations in counties, but it is worth noting in San Diego County, our cumulative case count per person is significantly lower than Riverside or Los Angeles or Imperial County, and so we suspect a little bit of this is, we still had less people per person contract COVID, and there's some fluctuations. And then it's also really important to keep in mind, COVID situation changes day by day and even week by week. We have seen some lower totals the last few days, and we'll have to see what the trends hold as we move forward. But for now, we're in the red tier. But again, looking forward to that June 15th date, which is right around the corner, where the plan is to lift all the tiers and all the restrictions. And so we want to continue to be cautious, continue to be safe. We're really doing well. Our economy is coming back. Kids are back in school. Our Padres are winning. People are getting vaccinated. All in all, we're in a really good position and continue to do very well. And we're very grateful for all the San Diegans that continue to be cautious and be safe. With that, let's jump into our charts real quick. The first one you'll see here is the vaccine shipments. What you see right there is last week we ended up at 310,000. That was a pretty considerable jump, a jump of more than 100,000 vaccines from the week before. And so you can see that number reflected there. And then what we are expecting this week is the 292, almost 293. So relatively flat and stable last week to this week. And then, like I said, we suspect next week we may get a few more, but we will share that with you. But again, generally encouraging and heading in a good direction. Next, you'll see on our dashboard here, again, 2.6 million doses administered. We are 71.8, almost 72% of the way towards that initial goal of 75%, about halfway there on fully vaccinated, and so continuing to make good progress. Again, our case rate remains really good. Our percentage of positive here, you'll see on the next chart, that 14-day rolling average. We will give it one sec here. Yep, that purple bar there, again, dipping down a little bit the last few days, now at 1.6%. And again, there's going to be day-to-day fluctuations based on a variety of factors, but you can see the last few days, 155, 160, 129, 144, 136, lower than where we've been, and so our case rate could be descending. That is encouraging. We don't have as many tests that are being reported on the whole. It varies pretty significantly day to day. And a part of that is a lot of folks are using antigen tests, and those are not counted. These are only PCR tests, and so a lot of rapid tests that are out there. So we think there's higher utilization of testing still happening, but what we count and report are PCR tests, and we will continue to make those available throughout San Diego County. And then the final chart here is just the one where you've seen the rough case count. And again, you see us holding relatively flat and stable there. Across the board for much of the last month. In the last few days, we have seen the numbers begin to decline, so we'll keep an eye on it and look at this as we move forward. That concludes my update. We're going to hear from Vice Chair Vargas, and then we will get into your questions. Both Dr. Wooten and Dr. Shaw are here to answer questions as well.
Thank you, Chair Fletcher. With all these updates, we have a lot to be excited about, and we can feel like we can see the light at the end of the tunnel. It's no coincidence that the state of California has the lowest rates of infections among every other state in the nation. And this is really due to the continuous work from every partner out there who's helping us fight against the virus. There's still a lot of work to be done, and we continue to find ways to distribute vaccines equitably and to ensure that hard-to-reach communities have access to continue the progress we've made so far to reduce the rate of infections. I think it's important to highlight that the partnerships with trusted organizations, community organizations, small businesses, and places of worship have really made a difference. We have seen the numbers in South County change because of programs like Project SAFE, which really were the interventions that helped us reach those underserved populations. We are now going to make sure that everybody receives the vaccine, and for that, we're going to make sure that these programs that were piloted in the South County are going to be piloted throughout North County. And as Chair Fletcher mentioned, 23 county-run sites are now going to be open up for walk-ups, right? And so that's really important because you don't need an appointment for that, and we're going to make sure that we emphasize that this is a program that started in South County. We know it works, and communities like San Isidro, over 99% of the population has been vaccinated at least with one dose, and the numbers continue to rise with our 65 and older population that has also already received the vaccination. And so we're going to continue to ask all of you to share with your family and friends, ask them to get their vaccines, and importantly for now, make sure that you don't lower your guard, and we continue to do whatever we can so that we are making sure that our communities and businesses can recover and become vibrant communities as we can be. Muy buenas tardes. Como pueden ver, cada vez estamos más cerca de un regreso a nuestras rutinas de antes. Gran parte de esto se debe a nuestros esfuerzos de vacunación que nos han ayudado a proteger una gran parte de nuestras comunidades. El éxito que hemos tenido en las zonas más afectadas se debe a la rápida respuesta de nuestro equipo, pero aún hay mucho trabajo que hacer. Las comunidades más afectadas por la pandemia ahora son las que presentan un mayor número de vacunaciones. Continuaremos nuestro trabajo hasta que todas las vacunas lleguen a nuestras comunidades. Por eso, a partir del día de ayer, las vacunas son disponibles en todos los centros de vacunación sin necesidad de tener una previa cita. Y sabemos que estos programas funcionan porque el programa SAFE que hicimos en el sur del condado de San Diego fue el que nos demostró que en realidad esa es una de las maneras en donde podemos reducir las barreras para nuestras comunidades para que tengan acceso a las vacunas. Así que de los 23 centros de vacunación del condado, pueden ir a cualquiera de esos y sin ningún costo alguno pueden recibir su vacuna. Esto nos va a ayudar a darle un empujón a la recuperación y será una gran ayuda para seguir combatiendo el virus y así reducir el número de casos y contagios en nuestras comunidades. Quiero enfatizar, como lo que se acaba de comentar, que tenemos un camino claro hacia la recuperación de esta pandemia, aunque el virus todavía sigue activo en nuestras comunidades, especialmente con las nuevas variantes. Nuestros números de casos continúan estables y el total de vacunas siguen aumentando. Esas son muy buenas noticias para nuestro condado porque es testimonio de todo el trabajo que se ha hecho como ustedes como residentes, al igual que nuestros pequeños negocios. Ustedes han seguido las indicaciones del Departamento de Salud Público y por eso hemos tenido el éxito que hemos tenido hasta el momento. Por favor, continúen con esta causa. Otra muestra de que seguimos progresando es que ahora las recomendaciones del Departamento de Salud del Estado nos dice que ya podemos estar en espacios abiertos sin el uso de cubrebocas. Así que recuerde que en los lugares públicos con mucha gente y en lugares cerrados se debe mantener sana la distancia y el uso de cubrebocas. No hay que bajar la vanguardia. Muchísimas gracias y juntos podemos lograr regresar a nuestras vidas cotidianas. Gracias.
Thank you. We'll go first to our call-in questions.
Matt Hoffman, KPBS. Earlier this week, the CDC reported that 5 million people nationwide have or will miss their second dose appointments, but numbers vary from region to region, and they sort of say it could be for a number of reasons. In San Diego County, do you guys know how many missed second dose appointments there have been? And are you able to say if that's because of like supply issues, hesitancy, or like lack of email or text reminders?
Yeah, we don't know the exact number. We haven't seen any considerable evidence or any significant concerns around missing second doses here in San Diego. We'll, of course, continue to monitor that. We'll work with all the health systems and all the various entities that provide second doses. But again, it's not an issue that's been raised of any particular concern in San Diego.
And then I know that the age group with the lowest percentage of total vaccinated here is 16 to 19, according to you guys' website. Can you guys say how many minors, 16 and 17-year-olds, have gotten shots? And do you think that there's hesitancy there from youth or maybe even their parents?
How many? What was your question again, Matt? How many?
Oh, sorry. How many 16 and 17-year-olds have gotten shots, like minors? And do you think that there's some hesitancy there from their parents or either from the
Yeah, I don't know. We can pull the numbers, Matt. I don't know if we have them. Well, let's see if we have them off just 16 and 17-year-olds there. And Dr. Wooten can speak to this, but there's also not every vaccine is available, and so there are limitations on that. In terms of what you can do. But I think Dr. Wooten may have some of those specific numbers for you and then can also speak to
that. Good afternoon. What we have are the age groups broken down by 10 years, but starting with 16 to 19-year-olds. So what I have is the group of 16 to 19-year-olds. And the total population for 16 and older, the 16 to 19-year-old, we have about almost 190,000 individuals, and the total vaccinated is 45,163. So it is a small number. 3.2% of that population has been vaccinated. And I'll leave this for you.
Thank you, Dr. Wooten. Matt, I also think it's important. I mean, we mentioned we're doing some targeted efforts around engaging youth to increase those numbers. Again, you know, that young population, Pfizer is the only one that's available for them, and so we're going to be adding to our sites kind of which vaccines are available to help people kind of schedule for that age group. And it's been really hard to get an appointment. You know, it's important. It was not that long ago we opened it up to everyone, and it's been challenging to get an appointment. So, you know, numbers are low in that group. We're doing a series of things to try and increase those. And, you know, we suspect the numbers, you know, will come up as we move forward. But it's definitely something we're thinking about and working on.
Thanks.
Thanks, Matt. Next question.
Melissa Adon, NBC7.
Hi there. Good afternoon. I'm just following up on the new CDC outdoor mask guideline, asking, is it enforceable? So we're wondering if the county has any guidelines on how they may be enforcing this. You know, it sounds like we are going to be following along with the CDC and the state's decision, but are we encouraging places like restaurants? Do they have the right to ask their patrons, hey, show us a complete immunization card prior to allowing them to remove their mask, or are the county just trusting in people's judgment?
Well, from the beginning, I mean, look, when we think about the mask requirements from the beginning, you know, it's been something that's been in the guidance, but never in San Diego County has someone, you know, been punished for not doing it. I mean, we have trusted, and we think we've seen widespread adherence to that, which is, again, why I think we've done well as a region. You know, restaurants and businesses have it within their own prerogative if they want to check, you know, ask people if they've been vaccinated and whatnot. They certainly can do that. But, you know, this is the guidance that's out there, and we trust that the overwhelming majority of folks will follow it. And, you know, look, I get there's a little frustration. Folks are like, I got vaccinated. Why do I still need to wear my mask at all? And I think it's just a recognition that a lot of people haven't gotten vaccinated, and COVID is still out there, and it can still transmit. And so we want people to just continue to be safe as we work our way out of there. I think as we come out of this recovery, you know, we're being safe, we're being cautious, we're getting our economy up and running. But, you know, we think most folks, by and large, are going to continue to follow the guidance because they understand why it's important. And we're in a period where, you know, things are loosening as we go along, and we're looking ahead to June 15th. So we expect there will be, you know, folks will generally say, hey, that's the guidance from the public health experts at CDP, at CDPH, at the county from Dr. Wooten. And we think folks will take that seriously and do it. But certainly individual entities and locations can you know, in force and say you have to do these things in order to patronize her. We'll go to our texting questions now.
This first question is from Jonathan Vosen with the San Diego Union Tribune. He wants to know from Dr. Shaw if she could provide an update on the breakthrough cases that were shared last week. Have samples from these cases been sequenced, and if so, are they more likely to be caused by a particular variant? Any other notable differences in the demographics, medical history, et cetera, of those breakthrough cases compared to overall COVID cases in the
We will
region?
turn that over to Dr. Shaw.
Good afternoon, and thank you for that question. So again, I just want to stress that, we expect to have cases that test positive after vaccination. So this is not an unheard of entity. And we have had 234 cases, which represents about 0.023% of those that have been vaccinated. So to answer your question, most of them, 55%, have been asymptomatic. There have been no associated hospitalizations or deaths with those cases. And, in terms of demographics, again, the vast majority of these cases are, in healthcare workers, which is not surprising because they're being routinely tested. And again, I'm going to stress that they've been asymptomatic, no hospitalizations, no deaths. So the vaccine is working, and I think that is the sort of key takeaway message from that. In terms of sequencing, most of these cases don't have enough virus to be able to even sequence. So I don't have the exact numbers of those that we have sequenced thus far, but it's only been a handful that we've been able to sequence. So hopefully that answers your question.
Thank you, Dr. Shaw.
Thank you, Dr. Shaw. We'll go to our next texting question.
This next question is from Richard Allen with CBS 8. He's asking, as more and more San Diegans are now becoming fully vaccinated, what is the county's stance on requiring some form of a vaccine passport in order to attend public events or conventions in the county, especially after June 15th when the tier system is going to be retired?
Yeah, the federal government has said they're not going to require vaccine passports. State government has said they're not going to require vaccine passports. And the county government has said we're not going to require vaccine passports. Individual entities have been given some guidance of the proper steps they can take to verify it. There are certainly some entities, whereas you have vaccinated sections or numbers, you can go higher with those numbers, and those entities have been given guidance on how to check. But in terms of a formal county-issued vaccine passport, that's not something that we will be pursuing.
Next question is from Mario Escobedo with Channel 8 as well. Can we get an update on COVID cases at local schools and how their return to class is going? Are there cases with students? Any numbers you can share?
Yeah, thank you. So in the last 14 days, we've seen 109 positive cases from K through 12 students. Does not mean that all of those kids contracted it at school, but students who are going to K through 12 is 109. Total for the pandemic is 3,100. But that's really to be expected. You have kids beginning to go back and a really significantly large number of school-age kids in San Diego County, the vast majority who are back at least some measure of time. And so it was to be expected that there would be some cases. There's testing available, and so nothing that is alarming or concerning at this point.
This next question is from Eric with Fox 5. Which areas are reporting the lowest number of vaccines administered?
Yeah, portions of East County, areas of East County is where we've seen some of the lowest utilization of vaccines and uptick. There's kind of pockets throughout. South Bay and South County in particular have been really saturated and done really well. But again, some areas of East County have seen some really low utilization numbers. And so we're going to keep working with community groups, folks out there, look at more mobile sites, more opportunities. Hopefully some partnership with some local elected officials out there to help promote the availability and access of it, in hopes that we can get the numbers up countywide.
This next question is from Claudia Bucio with Univision San Diego. She has several questions. The first one is, I stopped by several community pods in the South Bay, but they were pretty empty. Was this one of the reasons the county is accepting walk-ins now? Does there seem to be less interest now that we have more sites and more vaccines? And I'll read the second question after.
Muchas gracias por esta pregunta, Claudia. La pregunta es específicamente si ahora que había menos personas vacunándose en los sitios, porque pues en realidad lo que hemos hecho es saturado muchos de estos lugares, ¿no? Con información y haciendo citas para las personas. Pero es importante reconocer que las intervenciones que hemos manejado por medio del proyecto SAFE y las colaboraciones que hemos tenido con las organizaciones comunitarias son las que nos han hecho que las personas en realidad pues vayan y tengan este acceso. Una de las razones por la cual las 23 locales en el condado ahora la gente puede ir nomás sin a recibir su vacuna es porque sabemos que sí funciona. Queremos eliminar todas las barreras para que la gente pueda llegar y tener su vacuna. Así que si ves, por ejemplo, San Isidro, pues como hemos mencionado, ya la mayoría de las personas, 99% de las personas tienen por lo menos una vacuna. Las personas de 65 años en adelante en el Distrito 1, en el Condado del Sur de San Diego, también han recibido por lo menos una vacuna. Entonces, ahora lo que estamos haciendo es tener una colaboración con las organizaciones para recordarle a las personas. Y como sabemos, esta nueva fase en donde se le permite a todo el mundo vacunarse es muy nueva, entonces seguimos con la colaboración para que la gente sepa que se pueden ir a vacunar y ahora ya pueden hacerlo sin previa cita. Gracias.
And Claudia also wanted to know, are we having a problem of leftover vaccines or people missing second dose appointments?
En realidad, como lo mencionó el presidente Nathan Fletcher antes, es importante reconocer que por el momento no nos hemos dado cuenta que hay un gran problema en cuanto a la segunda dosis. Lo importante es ahora pedir a las personas que vayan por su primer dosis, ¿no? Lo que hemos hecho específicamente en las comunidades donde había habido algún problema en cuanto a poder hacer citas y eso, se les daba la cita inmediatamente a las personas, entonces por eso la gente sigue atendiendo y recibiendo sus vacunas. Así que por el momento estamos, no tenemos problemas de esos, pero vamos a seguir monitoreando la situación y si hay algún problema, pues creamos intervenciones para que la gente pueda recibir su segunda vacuna. Gracias.
Our final text and question today is for Dr. Wooten.
This question is from Paul Sasson with the San Diego Union Tribune. What does Dr. Wooten make of passing 1 million people fully vaccinated in San Diego, and what will it take to reach the next million?
Well, Paul, always thank you for your probing questions. So the fact that we've reached over 1 million vaccinations is a Herculean feat, and it is only due to the partnerships that we have with all of the healthcare systems, our outreach and education efforts, and all of the partners that are helping us. And our goal is, as we come to a kind of a crossroads, as was described by Supervisor and Chair Fletcher today, things change. Things are not going to stay constant. So as the temperament of the general public changes, our strategies must change. And so that's what we are doing, and that's what we will continue to do. In a month or more, we will be vaccinating children 15 to 12 years old. So our strategies will continue, and we will modify and react to the changing public sentiment. So we will continue so that we can get closer and potentially reach the 75 target. And that target, or that goal population, is just for the 16 years of age and older. We will have to readjust and modify that when vaccine is available for the population of 12 to 15 years of age. Thank you.
Thank you, Dr. Wooten. That concludes our media briefing for today. We appreciate everyone for joining us, and we will see you back next week.